What if I told you that some of the nerve damage people blame on aging isn't actually caused by aging at all? What if the tingling in your feet, the burning sensation at night, the numbness in your toes, or that strange feeling of walking on cotton could be slowed down, or in some cases, partially reversed simply by changing a few daily habits? Most people believe nerve damage is permanent. Once it's there, they assume nothing can be done. And while severe nerve damage can indeed become permanent, that's not the whole story. The truth is that your nerves are living tissue. They require oxygen, they require nutrients, they require blood flow. And when those things improve, nerves often function better. My name is Dr. Ethan Dean. I've spent years helping patients understand what their bodies are trying to tell them. And today, I'm going to show you how to protect your nerves naturally using specific foods, specific habits, and specific daily practices that support nerve health. Stay with me until the end because one of the simplest habits I'm going to share costs absolutely nothing, takes less than 5 minutes a day, and may be one of the most powerful things you can do for your nerves. Before we talk about protection, we need to understand what's actually damaging nerves in the first place. Many people think nerve damage happens suddenly. It doesn't. In most cases, it's a slow process. Imagine a garden hose. When water flows freely through that hose, every flower gets what it needs. Now imagine slowly squeezing that hose tighter and tighter. Less water reaches the end. Eventually, the flowers begin to suffer. Your nerves work in a similar way. They depend on healthy blood vessels to deliver oxygen and nutrients. When blood sugar remains elevated, when circulation becomes poor, when inflammation increases, or when nutrient deficiencies develop, nerves begin receiving less support. At first, you may notice mild tingling, then numbness, then burning, then pain, and sometimes loss of sensation. The encouraging news is this: if you catch the process early enough, your body still has an incredible ability to repair and adapt. Let's start with the first thing most people overlook: food. The average person thinks about food in terms of weight gain and weight loss. Your nerves think about food very differently. To your nervous system, food is information. Food is fuel. Food is building material. And certain foods provide exactly the nutrients nerves need to survive. Food number one: fatty fish, salmon, sardines, mackerel, trout. These fish are rich in omega-3 fatty acids. Omega-3s help reduce inflammation throughout the body. They also support the protective membrane surrounding nerve cells. Think of that membrane like insulation around an electrical wire. Healthy insulation helps signals travel smoothly. Damaged insulation causes signals to become distorted. Several studies have linked higher omega-3 intake with improved nerve function and reduced inflammation. Aim for 2 servings per week. Food number 2: leafy green vegetables, spinach, kale, Swiss chard, collard greens. These vegetables are loaded with antioxidants. Antioxidants help neutralize oxidative stress. Oxidative stress is one of the major drivers of nerve damage. Imagine leaving metal outside in the rain. Over time, rust develops. Oxidative stress creates a similar type of wear and tear inside the body. Antioxidants help slow that process. Food number 3: eggs. Many people are surprised by this one. Eggs contain choline. Choline plays an important role in nerve signaling and brain health. Your nervous system uses chemical messengers to communicate. Choline helps produce some of the most important ones. For many older adults, eggs can be a valuable part of a nerve supportive diet. Food number 4: berries. Blueberries. blackberries, strawberries, raspberries. These small fruits contain powerful plant compounds that help reduce inflammation and support blood vessel health. Remember what we discussed earlier. Healthy nerves require healthy blood flow. Anything that supports circulation also supports nerve function. Food number 5, nuts and seeds. Almonds, walnuts, pumpkin seeds, sunflower seeds. These foods provide vitamin E, magnesium, and healthy fats. Vitamin E helps protect cells from damage. Magnesium supports nerve signaling and muscle function. Many adults consume far less magnesium than they realize. Food number 6 may be the most important of all. Foods rich in vitamin B12. Vitamin B12 is absolutely critical for nerve health. In fact, B12 deficiency can directly cause neuropathy. Low B12 levels can create numbness, tingling, weakness, balance problems, and memory difficulties. Foods rich in B12 include fish, eggs, dairy products, and lean meats. For older adults, B12 becomes even more important because absorption often decreases with age. I've seen patients spend years searching for answers only to discover that part of their symptoms were related to a simple vitamin deficiency. Now let's talk about something equally important, foods that actively damage nerves. Because protecting nerves isn't just about what you add, it's also about what you remove. The biggest offender? Excess sugar. Every time blood sugar spikes dramatically, nerves are exposed to stress. Over months and years, those repeated spikes can contribute to nerve damage. That doesn't mean you can never enjoy dessert again, but it does mean becoming aware of how often sugar enters your day. Soft drinks, sweet tea, candy, pastries, sweetened coffee drinks. These are some of the largest sources of added sugar in the modern diet. Another major problem is ultra-processed food, packaged snacks, fast food, highly processed baked goods. These foods often promote inflammation while providing very little nutritional value. Your nerves need nourishment, not empty calories. Now, here's a question. What if the problem isn't just what you're eating? What if part of the problem is what you're drinking? Most people walk around mildly dehydrated every day, and dehydration affects circulation. When the body lacks adequate fluids, blood volume can decrease and circulation may become less efficient. That's bad news for nerves. Make hydration a daily priority. For many adults, simply drinking more water consistently can improve overall health in ways they never expected. And that's where we're going next, because food is only the beginning. Daily habits that can dramatically improve circulation, reduce inflammation, and help protect your nerves from further damage. Daily habits that slow nerve damage. The first habit is one of the most powerful and one of the most overlooked. Walking. I know, it sounds almost too simple. Most people are searching for a miracle supplement, a special vitamin, some hidden treatment that nobody else knows about. But when it comes to protecting your nerves, walking may be one of the closest things we have to a natural medicine. Every step you take increases circulation throughout your legs and feet. And remember what we've already discussed. Your nerves depend on blood flow. They depend on oxygen. They depend on nutrients reaching them consistently. Without circulation, even the healthiest diet in the world can't fully support your nerves. I've had patients tell me, Dr. Dean, I don't exercise because my feet already hurt, and I understand that. But here's what many people discover. When movement is introduced gradually, symptoms often improve rather than worsen. The key word is gradually. You don't need to run. You don't need a gym membership. You don't need expensive equipment. You simply need to move. Start with 5 minutes, then 10, then 15. Eventually, work toward 20 to 30 minutes most days of the week. Consistency beats intensity every single time. Now let's talk about another habit that directly affects nerve health: blood sugar control. And this matters even if you've never been diagnosed with diabetes. Many people think nerve damage begins after diabetes develops. The reality is that damage often begins years earlier, long before a formal diagnosis, long before symptoms become obvious. Every major blood sugar spike places stress on your nerves and blood vessels. Think about what happens after drinking a large soda or eating a pastry and sugary coffee for breakfast. Blood sugar rises rapidly, insulin rises, inflammation increases, then a crash follows. And that cycle repeats itself day after day, year after year. One simple strategy can make a surprisingly big difference. Eat protein and vegetables before carbohydrates, not after, before. When protein and fiber enter the digestive system first, blood sugar tends to rise more slowly. That means less stress on your nerves, less stress on your blood vessels, and better long-term protection. Now let's discuss something that most people completely underestimate: sleep. Because your body doesn't repair itself while you're awake. Much of that repair happens during sleep. During deep sleep, inflammation decreases, growth and repair processes increase. The nervous system gets a chance to recover from the wear and tear of the day. Poor sleep does the opposite. Research consistently shows that poor sleep increases inflammation, worsens blood sugar control, and increases pain sensitivity. In other words, poor sleep can make nerve symptoms feel significantly worse. If you're getting less than 7 hours regularly, improving sleep quality may be one of the most important health decisions you make. Try maintaining the same bedtime every night. Keep your bedroom cool, reduce screen exposure before bed, and avoid heavy meals late at night whenever possible. Now let's talk about something else that quietly damages nerves: chronic stress. Most people think stress only affects the mind. It doesn't. Stress affects every system in your body. When you're stressed, your body releases cortisol and adrenaline. Those hormones are useful during emergencies, but when stress becomes chronic, problems begin. Blood sugar rises, inflammation increases, blood pressure goes up, and circulation often suffers, all of which can contribute to nerve damage over time. One of the simplest ways to lower stress is controlled breathing. Slow breathing signals safety to your nervous system. It helps shift your body away from constant fight or flight mode. Try this. Take a slow breath in for 4 seconds. Hold for 4 seconds. Then slowly exhale for 6 seconds. Repeat for 2 minutes. That's it. Simple, free, and surprisingly effective. Now I want to discuss a habit that could literally save your feet: daily foot inspections, especially if you already have tingling or numbness. The danger of neuropathy isn't just discomfort. The danger is losing awareness. When sensation decreases, injuries can go unnoticed. A blister, a small cut, a cracked heel, an infection beginning beneath the surface. That's why I encourage patients to examine their feet every single evening. Look carefully, between the toes, around the heels, across the soles. Anywhere you cannot easily see, use a mirror. The earlier problems are discovered, the easier they are to treat. And speaking of your feet, let's talk about shoes. Because the wrong shoes create pressure. Pressure reduces circulation, and poor circulation places additional stress on already vulnerable nerves. Choose shoes that fit properly. Give your toes room to move. Provide support, and avoid walking barefoot for extended periods if you already have neuropathy. Protection matters more than most people realize. Now, before we finish, I want to show you several practices that many people never hear about. These are the habits that help create the environment your nerves need to heal. And while no natural method can guarantee reversal of advanced nerve damage, these practices may help improve nerve function, reduce symptoms, and support recovery when neuropathy is caught early. Let's start with circulation, because if blood can't reach a nerve, healing becomes almost impossible. One of the simplest ways to improve circulation is something called calf activation. Most people spend hours sitting every day at a desk, on a couch, in a car. And when you sit for long periods, blood flow slows down. Every hour, stand up for 2 minutes. Perform 10 calf raises. Lift your heels off the ground and slowly lower them. Then repeat. This simple movement helps pump blood through the lower legs and feet. Think of it as turning the circulation system back on. Another powerful practice is foot massage. Now, this doesn't need to be complicated. You don't need expensive equipment. You don't need a professional therapist. A simple 3 to 5 minute massage before bed can help stimulate blood flow and increase awareness of your feet. Use gentle circular motions. Massage the soles, the heels, the arches, the toes. Pay attention to how your feet feel. Many people with early neuropathy become disconnected from the sensations in their feet. Massage helps reestablish that connection. Some patients even use a tennis ball. Place it on the floor and gently roll your foot across it, slowly, comfortably, never aggressively. The goal is stimulation, not pain. Now let's talk about temperature. Your nerves are extremely sensitive to heat and cold. That's why some people with neuropathy feel burning sensations while others feel coldness. A warm foot soak can be relaxing and may temporarily improve circulation. But there is an important warning. If you already have significant numbness, always test the water temperature with your hand first. I've unfortunately seen patients burn themselves because they couldn't accurately feel how hot the water was. Safety always comes first. Another habit that deserves attention is maintaining a healthy body weight. Excess weight increases inflammation throughout the body. It also makes blood sugar control more difficult, and both of those factors place additional stress on nerves. The goal isn't perfection. The goal isn't becoming skinny overnight. The goal is moving in the right direction. Even modest weight loss can improve blood sugar control and circulation, and both of those improvements benefit nerve health. Now let's discuss supplements, because this is where many people become confused. The supplement industry is filled with promises. Some are helpful, many are not. One nutrient that deserves attention is vitamin B12. As we discussed earlier, B12 is essential for nerve function. Low levels can directly contribute to numbness, tingling, weakness, and balance problems. If you're over 50, take certain acid-reducing medications, or have digestive issues, discussing B12 testing with your healthcare provider may be worthwhile. Another nutrient that has been studied extensively is alpha-lipoic acid. Alpha-lipoic acid is an antioxidant. Some studies suggest it may help reduce symptoms of diabetic neuropathy by decreasing oxidative stress. It's not a miracle cure, but it has shown promise in certain individuals. Magnesium is another nutrient worth mentioning. Magnesium helps regulate nerve signaling and muscle function. Low magnesium levels may contribute to muscle cramps, weakness, and nerve-related discomfort. Again, supplementation should always be discussed with your healthcare provider, especially if you have kidney disease or other medical conditions. But here's what I want you to remember. No supplement can compensate for poor habits. Not one. The foundation always comes first. Nutrition, movement, sleep, blood sugar control, hydration, stress management. Supplements are exactly what the name implies. Supplements. They supplement the foundation. They do not replace it. Now I want to tell you about a patient I met several years ago. He was 62 years old. He came into my office convinced that nothing could be done. His feet burned every night. His toes felt numb, and he assumed the damage was simply part of getting older. We reviewed his habits. He barely moved during the day, his blood sugar was elevated, his sleep was poor, and he drank very little water. There was no magic treatment, no secret cure. We focused on fundamentals: walking, nutrition, hydration, better sleep, better blood sugar control, daily foot care. Several months later, he came back for a follow-up appointment. His symptoms hadn't disappeared completely, but they had improved significantly. The burning had decreased, the numbness had stabilized, and perhaps most importantly, the progression had slowed. That's the goal. Because when it comes to neuropathy, slowing progression is a victory. Protecting function is a victory. Preserving independence is a victory. And often those victories begin with small daily decisions. Now, I want you to remember one thing above all else. Your nerves are constantly communicating with you. Tingling is communication. Burning is communication. Numbness is communication. Pain is communication. The mistake many people make is ignoring the message. They wait, they hope it goes away, and meanwhile, the damage continues. The earlier you respond, the more options you have. The more nerve function you can preserve, the better your long-term outcome is likely to be. If you've experienced numbness, tingling, burning, sharp pains, or changes in sensation, don't assume it's just aging. Talk to your healthcare provider. Ask questions. Get evaluated. Because early action can make an enormous difference. And remember this, your body is remarkably resilient. It wants to heal. It wants to recover. It wants to function properly. Your job is to give it the tools it needs, the right foods, the right habits, the right daily practices. Do that consistently, and you give your nerves the best possible chance to stay healthy for years to come. If you found this information helpful, subscribe to the channel and join me for future videos where we break down complex health topics into simple, practical advice you can actually use. Because better health begins with better information. And today, you've taken an important step toward both. Thank you for watching.